Have you been losing sleep because of an annoying itch? It's so easy to just brush it off, isn't it? We often tell ourselves, oh, it's just part of getting old, or my skin is probably just dry. But what if that persistent itch is actually your body's way of trying to tell you something important? Today, we're going to talk about something crucial. Those itches you shouldn't ignore. I'm here to share insights from years of experience in healthcare, focusing on 6 specific types of itching in older adults that can be early warning signals for serious health conditions. Why should we pay such close attention to itching, you might wonder? Well, itching isn't always caused by simple dry skin or a minor allergy. Sometimes it's a deeper nerve reaction to internal inflammation, and in some cases, it can even be an early, subtle sign of something as serious as cancer. From countless patient interactions, I've seen that certain types of itching stand out. They don't get better with regular creams, they often get worse at night, and crucially, they tend to stay in one specific spot. These are all significant red flags that truly deserve our attention. Before we dive into these important warning signs, if you find this information helpful, please take a moment to like this video and subscribe to Happy Grandpa 69. Your support helps us reach more people, so your loved ones and others in our community can also benefit from these vital health insights. Let's start by understanding why some itches are different. When your body experiences internal inflammation or a developing condition, it can trigger nerve endings in the skin, creating an itch sensation even without a visible rash or external irritant. It's a complex signal system. It's not about causing alarm, but empowering you with knowledge. Knowing what to look for can make a significant difference in early detection and treatment. Our goal is to help you distinguish between a common nuisance itch and one that warrants a deeper look. Remember those key indicators. An itch that doesn't respond to moisturizers or anti-itch creams, one that intensifies during the night, and an itch that remains stubbornly localized to a particular area. Keep these in mind as we explore each type. First, let's talk about itching on the front of your shins. If you experience persistent itching on your lower legs, especially around the shins, it could be a warning sign. Take the case of Mr. George Miller, a 75-year-old who came to me with this exact complaint. He described a maddening itch on the front of his lower legs that would consistently worsen around 3 a.m. every night. He tried everything: moisturizers, compression socks, even massages, but nothing seemed to bring him relief. After thorough examination and some blood tests, the results revealed something unexpected: early-stage lymphoma. This highlights how a seemingly innocuous symptom can point to a serious underlying condition. For your self-check, try a good moisturizer or an over-the-counter anti-itch cream for 1 to 2 weeks. If there's no improvement, or if the itching gets worse at night, it's wise to consult a hematologist or an oncologist for further evaluation. Next, let's consider itching in the middle of your back. This type of itch, especially if it stays persistently in one spot, may not be a skin issue at all. It can actually be a referred pain from your pancreas, a vital organ deep within your abdomen. Mrs. Linda Brown, 68, experienced this. She tried changing her bed sheets, pillows, and even her shampoos, thinking it was an allergy or irritation, but nothing worked. The itch remained stubbornly in the middle of her back. If this back itch comes with other symptoms like persistent digestive issues, unexplained weight loss, or bloating, particularly after eating fatty meals, you should take it very seriously. These can be additional clues pointing to pancreatic concerns. For your self-check, gently press the itchy area in the middle of your back. Does it feel heavy or different from a normal skin itch? If you notice any unusual sensations or discomfort, get a general checkup and specifically ask your doctor for a pancreas test. Now, let's move to an itchy scalp or behind the ears. If you're experiencing persistent scalp itching that isn't caused by dandruff, a new shampoo, or typical irritants, especially if it worsens at night, this could be linked to blood cell disorders. Mr. Frank Johnson, 73, had this issue. He meticulously kept a diary of his symptoms, detailing the intensity and timing of his scalp itch before doctors eventually discovered he had a blood abnormality, specifically an early sign of leukemia. For your self-check, touch the itchy spot on your scalp or behind your ears. Does it feel noticeably warmer than the rest of your skin? Also, pay attention to other symptoms like unusual fatigue, easy bruising, or cuts that seem to heal very slowly. If you observe these, it's important to get a comprehensive blood test. Our fourth warning sign involves itching on the chest or around the nipples. If you notice persistent itching on one side of your chest, and the skin in that area looks red, rough, or has an orange peel-like texture, or if it loses elasticity, even without a noticeable lump, please be cautious. Mrs. Margaret Davis, 69, initially thought her bra was simply irritating her skin. She dismissed the redness and slight changes in texture for weeks. Tragically, it turned out to be inflammatory breast cancer, a less common but aggressive form. It's vital to remember that inflammatory breast cancer often doesn't present with a traditional lump, making symptoms like itching, redness, and skin texture changes critically important to recognize. For your self-check, look carefully in the mirror. Compare both sides of your chest for any subtle changes in color, texture, or size. And gentlemen, if you're over 60 and experiencing persistent itching around the nipple area, you should also get checked by a doctor, as men can also develop breast cancer. Next, we address itching around the anus or genitals. Long-term itching in these sensitive areas, especially if it feels like pinpricks, stays in one fixed spot, and doesn't improve with over-the-counter medications, needs immediate medical attention. This is particularly true if the itching is accompanied by any bleeding, changes in bowel habits, or unusual discharge. Mr. Robert Clark, 76, initially thought his hemorrhoids had returned, but he noticed this itching felt distinctly different. After further investigation, including a colonoscopy, a small tumor was discovered. This demonstrates why it's so important not to self-diagnose and to seek professional medical advice for persistent, unusual symptoms in these private areas. Our final type of dangerous itch is on your palms or soles. If only your palms or the soles of your feet itch, especially if you notice a slight yellowing of the skin, subtle changes in your skin lines, and it's worse at night, this can be a significant indicator. This specific type of itching can signal a systemic disease or even an internal cancer, often linked to toxins circulating in your body from a hidden tumor. Mr. John Anderson, 70, was initially told he had eczema, but his persistent palm and sole itching later proved to be a critical systemic warning sign. For your self-check, compare the color of both your palms and soles. Are there any subtle differences? If the itch doesn't respond to regular lotion or moisturizer after a consistent application, it's essential to ask your doctor for a full medical checkup, including blood work. Now that we've covered these specific areas, let's go over 5 simple self-check steps you can incorporate into your routine to stay vigilant about your health. First, the 3-week rule. If any itch lasts longer than 3 weeks, regardless of where it is, do not ignore it. This duration is a critical threshold for seeking professional medical advice. Second, try cream or lotion for 1 week. Apply a good moisturizer or an anti-itch cream once or twice daily for 7 to 14 days. If you see no improvement, or if it actually worsens, consider it a cautious red flag. Third, watch for other symptoms. Be attentive to any accompanying signs like unexplained weight loss, persistent fatigue, recurring fever, or wounds that seem to heal unusually slowly. These can be crucial pieces of the puzzle. Fourth, analyze the itch. Ask yourself, is it in one fixed spot? Does it consistently get worse at night? If these patterns are present, internal issues are more likely to be the cause than a superficial skin problem. And fifth, know your family history. If cancer or specific systemic diseases run in your family, you should be even more proactive about getting screened sooner and discussing any persistent symptoms with your doctor. A final word from someone who has spent decades in healthcare. Not every itch is cancer, of course, but every cancer and many other serious conditions Begin with small, subtle signs that are easy to overlook. For anyone over 60, if your itch is localized to one spot, resistant to creams, consistently worse at night, or comes with any other unusual symptoms, please do not dismiss it as just age. Your body is giving you valuable information. Get a medical checkup. Start with basic tests like blood work, and if necessary, your doctor might recommend an ultrasound or other scans to investigate further. It's always better to be safe and informed. So, for your homework tonight, before bed, take a moment to check the 6 areas we talked about. Note where it itches, when it happens, and whether it worsens at night. Mark it on your calendar for the next 3 weeks to track its persistence. If this video was helpful and empowering for you, please like, share it with your friends and family, and subscribe to Happy Grandpa 69. Let's help more grandparents, parents, and loved ones learn to recognize these early warning signs and prioritize their health. Health truly is the most valuable gift we have, and it often starts with recognizing and responding to the smallest signals our bodies send us. See you in the next video, where we'll talk about other common aging symptoms like joint pain, digestive issues, and headaches.